Hello, this is a very small presentation on the laws of access cavity preparation. We all know that the fundamental aim of root canal treatment is to remove bacteria and to treat apical periodontitis using biomechanical preparation, infection control and complete obturation of the root canal system. Now, in order to facilitate the root canal procedure, we have a triad, that is, an access cavity preparation has to be done, which is followed up by a biomechanical preparation and obturation. Now, in this steps, the first important step or a technical step is the access cavity preparation, which will enable one to gain a straight line access to the apical foramen. So by definition, an access cavity is defined as the opening prepared in a tooth to gain entrance to the root canal system for the purpose of cleaning, shaping and obturating. Now there are 9 laws by Ranker and by Krasner and Ranko, which will guide us in this access cavity preparation. Now, what are the 9 laws of Krasner and Ranko? The first 3 laws include the law of centrality, law of concentricity and law of CJ. Then it is followed up with the first law of symmetry, the second law of symmetry, law of color change, first law of orifice location, second law of orifice location and third law of orifice location. Now what is the law of centrality? The floor of the pulpal chamber is always located in the center of the tooth at the level of CJ. Now this law, how does it help? It helps in determining the depth to which you can go without causing a perforation. Now there is the second law, which is the law of concentricity. By this law, the walls of the pulp chamber are always concentric or around the pulp chamber, following its shape to the external surface of the tooth at the level of the CJ. Then there is the law of CJ, which should be used as a landmark to locate the pulp chamber as it is repeatable and consistent in its position in any tooth. Then you have the law of symmetry, which is, except for the maxillary molars, the orifices of the canal are equidistant from a line drawn in a mesiodistal direction through the pulp chamber orifice. Then there is the second law of symmetry, which is, except for the maxillary molars, the orifices of the canals lie on a line perpendicular to the line drawn to the mesiodistal direction across the center of the floor of the pulp chamber. Then there's law of color change. The pulpal floor or the pulp chamber floor is always darker in comparison to the surrounding dental walls. Then the law of orifice location 1. The orifices of the root canals are always located at the junction of the dentinal walls and the floor of the pulp chamber. Law of orifice location 2. The orifices of root canals are located at angles. See, there is an angle here. Angles to the junction of the dental wall to the pulpal floor. Then the law of orifice location 3. The orifices of root canals are located at the terminus of the root's developmental fusion line. Now the outline of access cavity will be determined by the shape of the pulp chamber and should not be governed by a preconceived shape in the mind of the operator. However, these laws by Krasner and Ranko will only act as a guide for the access cavity preparation. Thank you.